It's another Tuesday with Michelle, our heart health cardiac dietitian, who has been so helpful to me. And I'm so excited that she is joining us for the month of October. Last week we were talking about LDL. Well, first of all, we talked about like, what is the purpose of working with a cardiac dietitian? Michelle, you did a great job of explaining that and the importance of your work. And then we took a little side trip and started talking about supplements and things to like be cautious about when taking supplements, which then led us to this really great explanation about LDL in particular. And so that was such a fruitful conversation. And if you missed last week's, be sure to go back because Michelle does such a great job explaining about the impact of supplementation and what it can do to your kidneys and your liver, and how that, and this is me explaining from how I understood it, Michelle, but like how the downstream effects of that. So it was eye-opening for me. So this week, in taking that topic and now moving into blood tests in general, I mean, you are so great in looking at not just one value, say like LDL, but you are a big believer in looking at the whole picture. Can you educate us on that today?
Yeah, happy to. I think that there's a lot of misinformation out there because a lot of people are trying to cherry pick the data, right? They're looking at, okay, LDL cholesterol doesn't matter, only insulin resistance matters. You'll hear people saying, no, insulin resistant matters, LDL doesn't matter. You can hear everything and anything. I want to break the news to you. They all matter. Why are we picking which one matters? They may show up in different ways in different bodies. There are many times where insulin resistance will actually turn on genetic mutations that increase your risk of heart disease. They are both important. And for anyone to tell you that only one of these things is important is honestly not looking at the whole picture. Any diet that you go on should lower atherogenic LDL cholesterol, should lower inflammation, should lower blood sugar levels to optimal levels, should optimize blood vessel health and blood pressure values, should lower uric acid levels, should help with weight reduction around the waist circumference if that is pertaining to you. Everything that you are eating should not cause another metric to go in the wrong direction. It's all cardiometabolic health and they all matter. And so I really want your listeners to understand that it may show up differently in different bodies depending on your genetics, depending on the types of genetics you have. It also will show up depending on what you're eating. It will show up based off of your athletic ability. Heart disease does not discriminate based on body shape or size. I have many athletes who have had heart attacks. I have many individuals who are obese or morbidly obese who have quadruple bypass surgery. We need to be looking at the individual, but really looking at all your cardiometabolic metrics, and making sure all of them are optimized to your standards of risk assessment. So what I mean by that is when you look at your blood test, there's a big range of numbers. And a lot of times it'd be like, oh, my cholesterol levels are in range, my blood sugar is in range. But if you look at your risk profile or your genetic susceptibility, so if you have, for instance, a high lipoprotein A, LP little a, your ranges are much tighter and much lower than the general population. Those ranges are actually designed for more targeted treatment with medications. They are not necessarily designed to prevent disease. And so we need to be looking at these all in stricter standards and ensuring that we're optimizing all of the metrics together. A lot of times we don't really look at inflammation. And I want to bring that specifically because there's been a really good study in the New England Journal of Medicine that looks at individuals who've had a heart attack, who have normal LDL because they're on medication. But if they have a high hsCRP, which is an inflammatory marker, their risk of a subsequent heart attack is through the roof. And so that's kind of the idea, the information to understand. If there's havoc in the blood vessel, it's going to lead to more complications with heart disease. And havoc can happen in many different forms. Havoc can happen from high LDL atherogenic cholesterol that's inflammatory. It can happen from inflammation. It can happen from high blood pressure. It can happen from high blood sugar levels. It can happen from a multitude of reasons. It can happen also from your high uric acid levels or chronic kidney disease. There are many components here that we must look at in order to really reduce your risk of heart disease and realize that they all are important when we're trying to reduce risk of future complications.
Whew. I'm just thinking about, I rarely watch TV now, and if I do, it's like YouTube, catching my comedians from the night before. um, so that to say, I'm not as exposed to commercials as I used to be. But when I'm traveling or whatever, and there's a TV on, I'm still stunned by the amount of pharmaceutical commercials. And it's always like they're always addressing one thing. The person's always walking in the park hand in hand with someone feeding a duck. And like, and this one pill is going to lower this one value or raise that value or whatever. And I just think about how everything you just said is just not common knowledge. And again, I was not educated on any of this in the hospital, and I don't know any heart patients who were. I just struggle with how this is so siloed.
Yeah, it's an issue. A lot of this is awareness and taking it into your own hands of understanding what it is. The other truth is that's hard is many of my clients will go, okay, I went to my doctor and I asked for these additional tests, and they told me I can't take them, and you should go here and you should go there. You have the ability to be your own advocate and say, I want these tests because of XYZ, and make that a component to your care team, because without knowing these, you don't really feel these symptoms. You don't feel plaque brewing in your arteries. You don't feel even borderline high blood pressure values. You don't feel these things. So they silently brew. And that's why heart disease is so prevalent, because we don't have the opportunity to address them timely. And so I'm always very big about advocating for these components, and really making sure it is part of standard care. So being your own advocate is so important in this picture, and understanding why, right? God bless you, if you just bring in a whole slew of labs and say, I want these tested, but you don't give a reason for it, it's more likely not to be taken seriously, versus being like, you're not asking for too much. You're literally asking for an assessment of your cardiometabolic health, and that should not be denied to you. You deserve to kind of know, what are these values? And if they're elevated, we can do something about it. So why wouldn't we test it? Right. So
Right.
if they're high, we can then implement change, and you can retest it and make sure that it's going down and it's in optimal direction every 3 to 6 months, depending on the values that are showing up on your blood tests.
What's coming to me right now is we take better care of our cars than our health as a society, at least in American society. And when the check engine light comes on, we're running to the mechanic, right? And then they don't ask questions. They just have like this little diagnostic tool that they can plug the car into and tell us exactly what's up with the car, right? So I see these blood tests as being no different. We should just assume that the check engine light comes on every year because we're, fallible human beings, we're mortal beings. And as we age, things start to, you know, go a little awry. And just us plugging into the diagnostic tool and seeing what's up. And we are worthy of that. We are worthy of taking care of our bodies, and we deserve to have excellent health care. We deserve to be listened to by our doctors, and we are in the driver's seat of our own ship. We are the CEO of our health. And I
Yeah.
don't, we have also got to change the culture of just listen to the doctor. Like, sure, listen to the doctor, be respectful up to the doctor. And while you're being respectful, stand up for your health. You deserve to know what your numbers are.
So important, that piece of the puzzle of standing up for yourself, because listen, when you go to a doctor's office, they have experience in medical management of treatment. They're brilliant. I work with brilliant cardiologists and internists, and I love their brains and all the things that they can do to save people's lives. But you live in your body the most. And so you have a gut instinct of things in terms of you should get your questions answered. But if you're feeling fatigued, if you're feeling different than usual, please, I beg of you not to just think, oh, it's because I'm getting older. There's so many times my clients will say, oh, I thought I was just getting older. So I was feeling low energy and I couldn't go up the hill and I couldn't do the things that I used to do when I was younger because, now I'm in my 50s and my 60s and my 70s. And then when they nourish their body, they're like, no, Michelle, I'm faster than my kids. I'm faster than my grandkids going up that hill without huffing and puffing. It was an energy deficit. It was the fact that I wasn't getting in these nutrients. So I say this because a lot of times we get complacent in our care. We say, like, okay, the doctor told me to do this. That's what he said. But we don't ask questions. A lot of times my clients are on medications. They don't even know why. They don't know what they're for. And I'm here explaining the interactions with food and those medications. I'm explaining how these medications work. I'm explaining the side effects so that if they are intolerant to the medication, they're not just ignoring it. Your body is telling you things. And if you listen to it, you will help with increasing your quality of life, increasing your ability for your heart to function properly, and you're going to see you don't need as many medications because your body is resilient to recovery.
Yeah. Wow. Excellent. Thank you for that overall picture. And it's just such invaluable information. Let's leave it there for today. Again, we're doing bite-sized nuggets this month. So Michelle, thank you. And come back next week for some more truth bombs.
Thanks so much.
Okay.